Well, government officials scrambling to contain the coronavirus as the number of cases rise. New York Governor Andrew Cuomo confirming that there are now 22 coronavirus cases across the state, doubling overnight. Joining us now is Dr. Dena Grayson. She's a physician and a scientist who is an expert on viral pandemics. And Dr. Grayson, thank you so much for joining me today. When we take a look at where we are, there's been this lots of talk, obviously, about the timing just in terms of if we are going to develop a vaccine, possible treatments, also really pressure to get those diagnostic tests out there in a timely fashion. From your experience, I know you spent nearly 8 years working to develop a treatment for the Ebola virus. How do you compare what we're seeing with the coronavirus to what you saw with Ebola?
Well, this is quite different. With Ebola, we had really an outbreak that was localized to Western Africa with a few sporadic cases here in the United States. But fortunately, in our case, Ebola is not that easy to catch. You have to touch someone or be very, very close to someone to get the virus. And people, when they are contagious, they are really, really sick. Now, this coronavirus is different because the vast majority of people have very mild symptoms, but they are very contagious. So they're able to spread this virus because they don't feel very sick. They're comfortable leaving their home, and they're out there spreading the virus, unfortunately. So we now have here with coronavirus spread going on within communities in multiple regions in the country. And this is really just the beginning of what we will see of an outbreak here in our shores.
So do you expect a rapid uptick then in the number of cases once we get the tests out there, once there's more rapidly, they're able to disperse them at a much quicker rate and then they're more accurate results? So do you think we will get a solid uptick in those numbers?
Without a doubt, unfortunately, that's true. I think that right now it would be very safe to say that there are many, many hundreds of cases. And unfortunately, it's probably in the thousands. And you're right, as we have increased testing, we will detect more and more of these cases. But also, this virus is spreading. And I think that March is going to be quite, unfortunately, a bumpy ride.
So, Dr. Grayson, what are your thoughts on the House? They passed that $8 billion emergency funding bill to fight the coronavirus. Obviously, it was a lot more than what the Trump administration was initially asking for. Do you think it's enough? And how exactly do you expect it to be used?
I think it's a very important first step. I do think there are multiple areas that this money needs to be used. Number one is we need more testing, rapid testing, containment. Where are we going to house people? You know, if they can be housed at home, that's great, but our hospitals may run out of capacity soon. So we may need mobile hospitals to be built quickly, protective equipment. We need to invest heavily and quickly in getting vaccines available. So this idea that a vaccine is going to be ready in 3 months is unfortunately beyond misleading. That is not going to happen. And the only way we can expedite getting a vaccine is, frankly, you got to throw a lot of money at it. You've got to do everything at risk, manufacture the vaccines, the top candidates in parallel to doing the clinical testing to make sure the vaccine is safe and effective. So there are many, many ways. We need to pay for health care for people that don't have insurance for tests. We need to pay for their health care if and when they get sick. I mean, look, our public health is only as good as the worst and least healthy amongst us. This is an outbreak situation.
Dr. Grayson, do you think that as it stands right now, I know you're saying that we might need to do more for this down the road, but can the U.S. healthcare system, as it is, the medical system right now, handle the potential rapid rise in the number of cases?
I think there is an intense amount of concern about that. Unfortunately, the rollout of the testing, I think, as your viewers are quite aware, has been really bungled. And we are very, very late to this game. And the key with something like coronavirus, which spreads very, very quickly, is that you need to identify cases early and contain. So unfortunately, I think that it's not just burdening of our hospitals, which will be overburdened, especially in the areas where we have hotspots already, like Seattle area, the Bay Area and Los Angeles and now New York. But we also are public health systems. And this is going to get spread around the country. And I'm not trying to be doomsday here. I just think that people need to be prepared that March is going to be a very, very challenging month.
All right, Dr. Grayson, thanks for joining me.
Thank you.